Hi, my name is Sabrina Moscato, and this is my contribution to the Community Assessment Project. So for our community that we picked for the project, we picked Point Pleasant Beach. Point Pleasant Beach is a small oceanfront community located on the Barnegat Peninsula in Ocean County. It's really quaint, family town, great for locals and tourists as well during the summer months. So in Point Pleasant Beach, like I said, it really is a quiet small town. There is about 4,573 residents in total. Of that total population, about 21% is under the age of 18. So there's a lot of kids in this population, great for raising a family and young kids, a lot of kids to play with in the town. But also there's 70% of that population that is 65 years and older. So a large senior citizen community here as well. Great to raise kids and also retire. It really is a quiet town, except for the summer months, which we'll get into in a little bit. But of this population, it is majority white population, 97% of this population being white. There's also a high cost of living in this town, especially because it is at the Jersey Shore. That beachfront community, just slogan itself, raises the price here. So there is a total of 7,349 total households in the town. And the median value for owner-occupied housing here is really, really expensive, being $386,200. So obviously that's a high price. The median household income is just under six figures at $98,401. So again, this is an expensive area to live, expensive area to raise kids in, go to school in, but it really is beautiful. Of that population, that I mentioned earlier, there is 2.7% of this population that lives in poverty. So it is a small portion, but there definitely is poverty prevalent here. Of the people that are impoverished in this community, it is 100% Native Americans that take up a lot of that. There are 16 that are in the town, and 100% of them fall under this poverty line. Again, this is a expensive community. It is a beachfront community, so the poverty line and prevalence here might look a little bit different than somewhere in a more urban area like a city, but there definitely is some poverty issues as well. So moving on to recreation and destinations. Like I said, this is a great area for community and family type events in general. There are 4 great parks located in Point Pleasant Beach: Riverfront, Community, State, and Heritage Parks. So Riverfront is actually one of my favorites. I babysit for a family that lives in the Point Pleasant community or near it, and I love taking the girls here to this park. It's right on the water. It's got a great playground, a lot of space for them to run around, kind of burn off some energy. A lot of kids go there every day, so it's a great atmosphere, along with the great parks that are here with the soccer fields, and you can host events and do whatever you really want there. Of course, the beaches. The beaches here are beautiful. There are 2 main beaches. They have lifeguards during the summer, from morning to about 5 p.m. and then you're kind of on your own. But these beaches are beautiful. The downside here is that they do cost money to get on. That is because we're paying for things like lifeguards, staying all day, the cleanup on the beach, because with a lot of tourists in this area, there comes a lot of pollution and just partying that ends up with trash on the beach. So, great beaches, great for locals, great for tourists. We also have a lot of hotels in this community. This is great for, again, the tourists that are visiting for the beach or any other amenities that the town has to offer. A lot of them are right on the beachfront or close to, a block away. That's walking distance from the beach. So this is a great moneymaker for the town as well. And then, of course, Jenkinson's, which most people are familiar with. There's a big arcade and boardwalk. It has bars and restaurants and amusement rides for the kids, and pretty much something for everybody there. So that is great for the locals and tourists in the summer. It's a lot of fun. It's open at night, pretty late, pretty cheap to get tickets, and just go and spend the day with the family. Then, and the aquarium is open all year round. Also a great attraction for kids and family. Then there is the Hackensack Meridian Health Ocean Medical Center that is located just under 10 minutes away from Point Pleasant Beach. It's in Brick, technically. I would say probably way less than 10 minutes. It's a great facility. It's not fully equipped, but it definitely can give you that emergent care or inpatient stay that you need, and if need be, you would be transferred to our other HMH facility, which would be Jersey Shore in Neptune, which is where we have our clinicals. Again, not too far from Point Pleasant Beach. Aside from all the great tourist and local attractions, there's also plenty of grocery stores, convenience stores, banks, pharmacies, gas stations, full service restaurants, local shops, pretty much anything that you could think of and need in this area. So this benefits locals majorly. They don't even have to leave the town for any amenities that they really would need. There's a lot of religious dwellings as well, either in the town or very close nearby. So moving on to the school district, Point Pleasant has a larger school district. It has 2 elementary schools, 1 high school, and 1 middle school. The mission statement here is to assure that all students are equipped with the essential skills necessary to acquire knowledge and understanding, and to instill the desire to question and look for truth, so that students may become critical thinkers. I'm sorry, my phone is right on this. It's making my computer go crazy. Sorry. Oh God. Okay. To instill desire to question and look for the truth, so that students may become critical thinkers and lifelong learners, and to ensure that all students practice self-discipline, perseverance, fairness, and judicious decision-making. This is just a school district saying that they like to abide by these. Okay. Community assessment of the town. Like we said, Point Pleasant Beach is a great tourist attraction, and for locals as well. The main means of transportation in this town is by motor vehicle, at about 91%. This prevalence is even more in the summer months because there's a higher population due to all the tourists that are visiting. But there are other means for transportation in the town. There's buses, there's a train, taxi services, and also great areas for walking. There's a very high quality streets with sidewalks, and of course the boardwalk, if you want some exercise or just some recreation outside. Also the parks are great for walking as well. The town of Point Pleasant Beach also has its own police department, fire department, and EMS teams, which is great. They're quick responders. Again, it's a small town, so respond pretty quickly, and are pretty friendly with the community as well. This town also holds fresh seafood and farmers markets a couple months out of the year, and on Sundays, I believe. So this is a great attraction to just get out with the family, kind of spend some time outside, get some fresh produce, and be around in the town. There are also a lot of family-friendly shops with cute things about Jenkinson's or the aquarium or just the beach in general that have Point Pleasant Beach's name on it. Great little shops to buy gifts for. There's restaurants, there's an amusement park at the boardwalk like we talked about, and the arcade and the aquarium. Just really a great area for being outside and being with your family or friends. Going on to community events here. If you go onto pointpleasantbeach.org, there is a calendar there that lists all their community events, but for some, in the summer months, they do free movie nights on the beach every Tuesday, which is great for the community. It's a great way to get out, spend some time with your friends and your kids and whoever else is out. This is really great. It's super fun. They play good films, and they also have fireworks on Thursday nights, which many people are familiar with. You can watch it from a couple different beaches, but Point Pleasant Beach is one of them. And then from June to October, there is that farmer's market every Saturday, like we talked about. Every Sunday during the afternoon. This is a great way to socialize, just walk around, buy some fresh food. So moving on to our community needs. Basically, we identified these community needs through our informant interviews, one being the school nurse. So the school nurse that works in the Point Pleasant Beach district identified some populations in need as the type 2 diabetes population in the schools, and another being parent-child education on COVID-19, with these various topics below, talking about vaccinations, mask mandates, social distancing, additional health needs since the COVID pandemic has begun. And then based on an informant interview with a police officer from Point Pleasant Beach, we addressed some more needs that were increased town population and motor vehicle traffic, loud noise and public intoxication, and the prevalence of drinking and driving that is most prevalent during the months of May through August. So those summer months where tourists really do come in and kind of stir some stuff up. So Based on informant interviews, these are our strengths and weaknesses that we identified. So there's a lot of strength, which is great. We identified that this is really a friendly, warm, family-oriented environment. This is a great location for tourists and people who live here locally. There's always something to do. There's always kids outside. It just really is a great small community. It's like a small family. There's also the great benefit that these town council meetings that are held really do listen to community, because it is such a small, close-knit family that these needs and concerns are addressed right away at these meetings. It's open to the public, or at least most of them are, and those needs are not only being heard, but they're being taken into consideration. Along with that, we have the town events and the community events that bring everybody together and bring that community vibe and family vibe out into the public. It is a clean, safe, family-oriented community. Like we said, we have our clean beaches and clean parks thanks to our public safety people and our public works. And then there are several religious dwellings that are either in the town or right in close proximity in neighboring towns that residents of Point Pleasant Beach are able to go to at their convenience. Some areas for improvement that we addressed were the overcrowding during the summer months. This is with motor vehicle traffic and population in general. There's just a lot of more people that do come in the summer months, making the town crowded. Again, we have that pollution and trash that comes with those visitors and tourists, unfortunately. So we definitely want to improve in that area. Another area for improvement is the limited resources for low-income families. Again, with that small percentage of only 2.7% of the population being in poverty, there's not a ton of resources for them as far as food, transportation, healthcare options, things like that. There's not a ton for them to choose from. And then lastly, paying for community amenities such as beach access and parking, as I mentioned. Not great, but there are benefits to that as well. So we want to kind of be in the middle somewhere with that. So moving on to our action plans. Our first action plan, our problem here is addressing the motor vehicle accidents and disturbances that affect the general population. Like we said, it's mostly prevalent during those summer months, May to August, even September a little bit. The contributing factors here are pedestrians increasing in the summer due to like tourist locations and partying and being out in the street. These pedestrians are walking around, and of course there's also the prevalent more motor vehicle traffic that comes during these months, so this creates a danger to the population. If the problem is not addressed, there will be an increase in mortality as well as hospitalizations in the town. The goal here is to preserve the safety of the town and of course the people. And the plan of action here is to have law enforcement really hold these tourists and even locals accountable. We don't want any drinking and driving to be going on, any reckless or public intoxication that puts others in harm. The law states that individual may be fined $200 in court, receive 2 points on their driver's license, and may serve 15 days in community service if driving under the influence. So we really want to have stringent laws and accountability on that front. We want to place more road signs and so that these pedestrians are crossing safely. We want servers to be stringent on their limits with alcohol, making sure that people are able to walk out of the bar, and definitely if someone's driving, be very strict with those limits. We want more education on alcohol safety and driving safety in the community. Public Safety Administration and the mayor of the town, Paul Canitra, can help with executing these community changes that we want to see. And our evaluation plan here is that there will be decreased incidents of motor vehicle accidents involving pedestrians and drivers under the influence of alcohol. So moving on, our next action plan, let's talk about it. So our problem here is that children and their families are left in the wake of COVID-19, and what's next? So our contributing factors here are news outlets, politics, federal mandates. And if this problem is left unresolved, this generation of children will be left confused and possibly fearful of healthcare moving forward. These kids, a lot of them are growing up in a world of masks and washing your hands immediately and not touching this and cleaning this and not wearing shoes in the house. And it's confusing. It's hard to talk about, and I think this needs to be brought up with families and their children. So the community will benefit from this problem because children and their families will be encouraged to have open dialogue about things like the cause and lasting effects of the pandemic, the importance of vaccinations, the importance of autonomy, isolation precautions, and life and death. Plan of action here is to organize weekly meetings where children and their families can join, come on in or join virtually, and talk about this pandemic. The evaluation here that we want to see is that children and parents are feeling more comfortable talking about the pandemic and what's gone on in the past couple months and years, and children and parents will understand the importance of vaccinations, autonomy, isolation precautions, and understand the process of life and death as it's seen in healthcare. We don't want it to be scary or, scare any children or anything, but it is relevant. So we definitely want to be able to ease that conversation when it does come time. Another action plan we have is the sweetest classmate. The problem here is that the Point Pleasant Beach School District has several students that suffer from diabetes, and their classmates are often left with questions. They see their classmate always gets to leave early before lunch or after lunch or before recess. They're going down to the nurse's office, and the nurse pays them so much mind, and they're confused, they're nosy, they're kids. So the contributing factors here are, like I said, these students are going to have their glucose checked before meals or before exercise or whenever, especially if they're sick or on medication. That would, the prevalence would be more. So this, again, means a lot of trips to the nurse's office, and kids are nosy. Kids are going to notice that their friend goes every single day at a certain time. So if this problem is left unresolved, children may pick on these diabetic students, they may be misinformed about the disease process, and children will not know what to do in the face of a diabetic emergency in order to help their classmate. So the community will benefit from this problem being addressed because children will be able to recognize these signs and symptoms of distress in their diabetic classmate and hopefully be able to intervene. The plan of action here is to organize an informative assembly for affected age groups that discusses the diabetes mellitus disease process using animation or book or movie, whatever can really capture the kids. It really depends on the age group that we're talking about. Also the management of the disease and the presentation and warning signs of a diabetic emergency and how to be there for our diabetic classmate. The evaluation plan here is that children in the school district will be educated on all of these things and, most importantly, be able to help their friend in a time of need if necessary. This will not only help educate those students around them, but for the diabetic classmate themselves, hopefully they will feel more comfortable, less embarrassed, and more appreciated as well. So for our advocacy letter, one, we wanted to write to the Point Pleasant Board of Education with the intended recipient being the superintendent, Dr. William Smith. We want more robust health education and open dialogue for students regarding prevalent illness, such as things like COVID and diabetes, things that are relevant to the school and the area. Informant here is our school nurse that we want to work with and make sure that that information is being relayed properly. Another advocacy letter that we wanted to bring to light was to the Borough of Point Pleasant Beach itself, with the intended recipient being the mayor, Paul Canitra. We want stricter measures for public safety during those summer months as far as motor vehicle accidents, drinking and driving, public intoxication, and pollution. We want more crosswalks, pedestrian signs, more discussion about limitations on alcohol with the town bars and restaurants, and we want to push that conversation to make a safer town for our locals who are here all year round, not just here during the summer months. So those are advocacy letters. And moving on to our evaluation, we want to implement this new health education, open this dialogue for the first year, and see how it goes. See how those open dialogue conversations go. See if people are attending, if people have more questions, or people are not really into it. We want to be using qualitative surveys and student interviews to determine if there is improvement in the knowledge and rate of diabetes and COVID. And our ideal results for this is that there be a decreased rate of diabetes in the pediatric population of Point Pleasant Beach, which again is that 20% of the population here. So we're talking about a large number of individuals. And we also want students reporting less anxiety, or less questions about COVID-19 and the measures that go with it. And we would reassess and formulate a new intervention if needed. And then we would also want to implement the stricter measures with law enforcement to tighten public safety for a period of one summer. That's when it's most prevalent, so we want to test it out one summer. Let's see how it does. We would like to use data from police reports, local newspapers, interviews, and etc. to determine any rate of change in mortality rates, hospitalizations, motor vehicle accidents, public intoxication, etc. The ideal results here is that there be a decreased rate of motor vehicle accidents, increased pedestrian safety, and decreased incidence of drinking and driving. And again, we would reassess and formulate new intervention if needed. So that is our presentation, and I hope you enjoyed. Thank you.